Okay, so we'll be having Osce session today, and then lecture is commencing now. It's going to be an interactive section, so where you will be providing the answers, and at the end of the day, we will come to a conclusion about the answer. So, if I will ask, can someone identify this image? Can someone identify this image, please? Sorry, I can't hear you.
Foley catheter.
Okay, right. But the correct answer will be a two-way Foley catheter, right? Sometime in the exams, they may put it in the pack. So when they put it in the pack, please and please, you are advised to look at the pack properly and then check for the size. So if it's in the pack, and also if it's not in the pack, you look at this body, right? You can see this part here, right? You can see the cursor. Can you see my cursor? Can you see my cursor?
Yes, sir.
Okay, that's where you see the size. In case it's not in the pack, you can see this point here. The size is always written there. So the correct answer will be a two-way Foley catheter size. We don't call the size 18 French gauge or size 16 French gauge, or there are size 14 French gauge. So that will be the complete answer. A two-way Foley catheter size, we call the gauge. So if it's in the sachet, you see it written in the sachet 18F, 16F, 14F, like that. So you must put the size, you must put that the ways, whether it's two-way or three-way catheter, because sometimes it can be three-way. You see the third part here. So now you see the third part there. That will be three-way Foley catheter size. So can you list two uses of this catheter? Can you attempt to list two uses? Or can we attempt listing two uses of this catheter? Okay, let me assist in this one. One, it can be used to drain urine. Okay. One, it can use to drain. It can be used to drain urine. Two, it can be used to monitor urinary output. Three, it can be improvised as a chest tube. Four, it can be used as a tourniquet in the uterus during myomectomy. It can also be improvised as a tourniquet in hypospadias repair in some instances. So again, if there are two uses you must mention, it can be used to drain urine from the bladder and can be used to monitor urinary output. These are the two major uses. It can be improvised, and that use again can be improvised as a chest tube to drain pleural fluid content. So these are some of the uses. Okay, can we attempt to label the parts of this catheter? Let's attempt it, please. Can we attempt it? Can we attempt it, please? This class will be better. It will be better if it is interactive. So let's try. There's no harm in trying and then not getting it. So you get it's better you force yourself, and then at the end of the day, you learn from it, from your mistakes you get. So can we attempt to label the parts?
Two-way
Um,
Foley's catheter.
Could you talk loudly? I can't hear you very well. Let's attempt. Let's try.
The colored part, I think, is for irrigation, while the other part is the other tube is for um,
Okay, you
drainage.
tried.
let me try, doctor.
Okay, okay,
Okay, we have the bladder opening, the hole
okay,
from the upper part. Then we have the
okay,
balloon,
okay.
which is the round part.
Yep.
Then I think we have the bladder pot or something from the downer part there.
Okay. Okay. Well done. All of you tried, and I think I'll commend you people. You did well. Now for this end, right? This part, this tip here, right? There's an eye, right? And called the opening. It is here. It's from this point that urine from the bladder flows through and out. Here is the. It's called an inflatable balloon. This is the part that it is inflated with sterile water to anchor the back balloon to prevent it from falling off. Then here is called this part is called the drainage channel, and here is called the inflatable cuff. Again, this is the inflatable cuff. You can see it here. Sorry, you can see it here. This is the inflatable cuff. This is the drainage channel. This is the balloon. This is the tip, and this is the eye. So those are the parts of the Foley's catheter. So what are the types of Foley catheter? So what are the types of catheter you know? Can you try? By saying, can you try?
Three-way catheter and two-way catheter.
Okay. What is again? Okay, we have a three-way catheter, we have a two-way catheter, we have a one-way catheter. That's type one-way catheter, two-way catheter, three-way catheter. This is a two-way catheter, 1, 2. If we have a third port here, it becomes a three-way catheter. In another instance, it will just have only one port. This one, it's called a one-way catheter. This catheter can be metallic, it can be it can be rubber, or so it can be metallic, it can be latex, it can be silicone. So we have metallic catheter, latex catheter, or have silicone catheter. So those are types of catheter. Then catheter can also be classified based on the tip, cool dick tip and non-cool dick tip catheter. But for your exam, I don't think you just know one-way catheter, two-way catheter, three-way catheter. That's a type of catheter. And metallic and then non-metallic catheter. Or you could say metallic, latex, and then silicone catheter. Those two major grouping will be okay for you for your exam. So let's move to the next one. Is there any question before we move forward? Is there any question?
No question.
Okay, fine. So can someone identify this image?
This is an NG tube.
A nasogastric tube.
Sorry?
Nasogastric tube.
That's why I identify this image. Okay, correct, in nasogastric tube. I 100% agree with you. So, what are the possible uses of this tube?
Stomach decompression.
We have therapeutic and
Okay,
cosmetic uses.
I agree with you. That's one. What else again?
Feeding.
Feeding, right? You said
Yes.
correct. What else again?
Drug administration.
Okay, those are the basic two. If you mention these two in exam, yeah, okay, you get you're home and dry. But it can be improvised for other purposes anyway, sha. But if it says to decompress the stomach, correct, to feed a patient, you're absolutely right. So what are the possible complications of this tube? I didn't add that in this question, but I think it should be part of it. So what are the possible complications?
Bleeding.
Perforation of adjacent organs.
Okay, correct. What else again?
Dislodgement.
Correct. You are very correct. What else again?
Blockage.
Sorry, I can't hear you.
Infection.
Oh, well, maybe not then. But someone said something just now. Infection, well, maybe, but that should be down. This thing can get blocked, right? Anytime you say it, you will remember that actually can be blocked. So blockage of tube is another one. This tube can get broken. Fragmentation, it can fragment. So those are possible complications, you get. So I guess we are. Is there any question anyone want to ask again before we move to the next slide?